Shisha smoking has become a growing trend among Nigerian youths, but beneath this social act lies a lot of health risks.
So in this special report, senior reporter Olaide Oyewole explores the implications of this youthful exuberance.
It's now a fad amongst youths. It's not about beating them. It's now about joining the fray. Most sit-outs, clubs, lounges in major cities in the country now offer Shisha as one of their services. And guess what? Shisha is a traditional Middle Eastern and Southern Asian smoking device that uses a water chamber to cool and filter smoke produced by heated tobacco, or most times herbal alternatives. It originated in India, where it was used to smoke flavored tobacco, and then the practice spread to Persia, modern-day Iran, evolving over time. Shisha smoking has now become a global activity. An online survey conducted for this report found that 25 out of 50 respondents between the age of 18 and 40 engaged in this activity. 13% out of these respondents smoke Shisha daily, while 13% also smoke it weekly. 7% smoke it monthly, while the remaining 67% smoke Shisha rarely.
Well, personally, I think that I don't think it's actually good for the body, because I don't, but it's their choice anyway. It's what you prefer, it's what you can do with your life. You can do anything with your life. But I don't take it, I don't like it. I don't think it's good.
I think it's their way of life, so they have right to take it whenever they want to, yeah. So I'm not disputing the fact that it's good or bad. I'm not one to tell them to stop or continue. Whatever you think you want to do with it, just keep on doing it.
To really know why Shisha is now cherished by youths, I decided to spend the evening with Isaac and his friends at their favorite leisure spot in Ibadan. After obtaining their consent, I engaged with them in conversation, why and when they took to smoking Shisha. To Isaac, who stumbled in the substance months ago, a drug eases him of stress.
I think it's good than taking cigarettes, so it eases my stress. It's the reason why I take it, that's why. But, you know, in this life, we all are doing anything that concerns any one of us. I'm different, you are different. What you can take, I can't take it. But for me, I won't condemn that Shisha is not good. It is good, but not too much. But I just take it to ease my own stress, that's all. So I didn't find there's no joy in it. I'm just taking it to ease my stress.
While it is more of stress reliever for Isaac, his friend said they love the different flavors Shisha offers.
It's very flavor, she makes sense. I know the change flavors. That flavor is makes sense. Anything, Shisha is not bad.
Kolade, a Shisha vendor, told me he ventured into the business since he couldn't get a job after serving 3 years apprenticeship. Now, he seems to have found a new trade that makes him a boss.
Because I'm not in club, this place is bar, understand? I make per week 8,000. The reason is that most girls don't smoke Indian. They don't smoke most girls they don't like to smoke cigarettes. That's why I'm taking Shisha. Because Shisha is just like a fun to everybody. That's it.
He even gets contracted most times by clubs and lounges.
I take to the club. I've been in Platinum, Sluggard before. I take Shisha there. Then I'm with my boss then, because before I stay on my own. No, we have this. This one is being used now. You have new one here. If two persons want to take the Shisha, right? I will give them 2 this thing. If not 3, I will give them 3. They don't change. They'll be changing the pipe. If I want to pass this now, if I want to pass it to another person, I will remove my own, and the person will put his own.
While Shisha seems like a harmless social activity, its health risks are real and alarming. Dr. Odunla Olabinton, a medical practitioner, highlights the reasons why one should not indulge in this activity.
Shisha has the same effect as smoking a cigarette, right? Because it contains the same major component, that is tobacco, right? So, and people are even more exposed to more harm when they use Shisha than smoking tobacco. Not like more than. People are even exposed to more harm. Yeah, a lot of harm when smoking Shisha, even as smoking cigarette. Because in a Shisha sessions they last longer, right? So people are there just smoking Shisha for 60 to 80 minutes, and in that time you have consumed the same amount of harmful chemicals as you would have if you had smoked like 80 to 100 cigarettes. Shisha session of about 1 hour is similar to smoking 100 cigarettes, right? So you are even exposed to more harm, and harm can include addiction. So Shisha can be addictive because it contains nicotine, which is the same active compound that is found in cigarettes, which makes it addictive. It can increase your risk of heart and circulatory diseases, right? It contains tar, it contains carbon monoxide, it contains carcinogens. Carcinogens are things that cause cancer.
According to the World Health Organization report in 2019, an estimated 12,000 deaths occur annually, and public health expert believes the number may have increased.
And there's something that people do when they're smoking Shisha. They don't smoke alone, they pass it around. You understand? So you're at risk of tuberculosis in that regard, you're at risk of herpes, you're at risk of hepatitis. So the health risk of Shisha cannot be overemphasized. So I think the passing the Shisha thing around is the same thing some people do when they share joints, like rolls of Indian herb, So especially among young people, if you go to expensive lounge, this thing is not cheap, right? One person, some people can even contribute money. One person buys and is like, yeah, let's pass it around. So you don't know if the other person has brushed, but because they are your friend now, one person smokes, passes it to the next person, passes it to the other person, and so on and so forth.
The growing public health concern of smoking this substance underscores the need to strengthen evidence-based education, promote regulations, and ensure accessible support services for those who engage in this activity. Olaide Oyewole, TVC News, Ibadan.